Okay, so I'm just going to do a little video here. I'm not going to leave it very long. We're going to touch base on Amari's medical files. I found them, and I'm going through them now. When I got them, I put them into sections. I sectioned them off. And what I'm looking at right now, basically, for the most part, is at the time of his birth and everything that they did in that little short window of time. Recap. Shimei started labor pains, but we need to keep in mind, people, Shimei had abortions, okay? So her cervix, and you know all that, where the baby comes out, right? The cervix, right? Because I think it's the cervix that opens up, right? As you go into labor so that the baby can come down the birth canal, pass through. It had already been manipulated through the process of abortions. Now, this is really important for women in general. I was pregnant 8 times, and I had 5 live births through my vagina. Marcane was 9 pounds, people, and it took me an hour, literally, to push him out. And they cut off the epidural because it was freezing up into my chest area. So they had to cut it off. And Marcane's heartbeat through my contractions, okay? Even with pushing him out for that 1 hour, with my legs like this, with 2 people on each side holding my legs, okay? And it burned so bad because he was so big, okay? And after an hour, he was born. But through that process, his heartbeat was going down, but after the contraction was over, it'd go back up. So I never needed a C-section, okay? And after an hour of pushing without an epidural, that was not a very fun birth, trust me, okay? I know what fun is and I know what fun is not. He came out, and all I required was 2 stitches. That was it for a 9-pound baby. And I'm very petite, okay? The point is I had 5 natural births, okay? Whereas Shimei, she had already had 2 abortions that I know of. Maybe there was 3, I don't know. And her cervix was already overstimulated from that process, okay? Plus she had a very like a really, really tiny, teeny, weeny waist, you know, right? So I don't know if that played a role. The point is, she started labor. She came upstairs, she complained to me. And you have to remember, I was really distancing myself from Julian because he was so violent and abusive, right? So, you know, I couldn't get in the middle of Shimei and Julian. And of course, Shimei allowed Julian to be in the process, basically, of birth because she wanted Julian to be proud of the baby. Because, you know, Julian fed into that, oh, my, you know, my baby, and, you know, it's just a woman thing, okay? She wasn't ready to throw Julian off to the side, right? And you have to remember, I pleaded with Shimei to keep Amari, to not abort him because of what basically Julian was doing. I told her it was okay to be a single mom and that she had choices. She could either give the baby up for adoption if she really felt that she didn't want the baby but have the baby anyway. You know, you've already had your abortions. You don't need to punish yourself, punish innocent fetuses, and just whatever, right? Just suck it up. And, you know, you'll get through it. Whether you give the baby up or whether you raise the baby, and I'll always be there to help you. I told her that. Or if you really felt that you couldn't give the baby up and you couldn't raise the baby, you know, I'd look after the baby. But ultimately, you know, it's your baby, you look after your baby. right? That was my motto with her, right? And I encouraged her to keep the baby and not get into that routine, because you have to remember, people are influencing her to abort the baby, especially the medical care system, because they take those fetuses and they do science experiments on them. Let's be realistic, okay? So the more fetuses they have to do whatever it is that they do through their trafficking of fetuses, dead fetuses at that, well, now in the United States, they're allowing women, they're passing laws in certain states where they're allowing women to actually kill their babies after they're born, right up until 7 days after they're born. And they're pushing it like where mothers can say, well, the baby is 3 months old now and it needs to be murdered, aborted, killed, because I don't want it. Like, you know, it's just getting worse and worse and worse through this right for women to kill their children. And, you know, so, you know, she getting that from the healthcare clinic, from wherever, right? And I said, no, stop. Just stop. Have the baby. If you can't look after it, give it up, or look after the baby and I'll always be there to help you. Or if it comes to that, you can give me the baby and I'll look after the baby. Either or, just don't abort it. I gave her choices, and I pleaded for her to keep it, the baby. So she chose to keep the baby. Okay. And then, when it came time to give birth, she came up and she says, oh. And I'm like, well, go to the hospital, okay? So she went to the hospital complaining about labor pains. They sent her home with morphine. She didn't take the morphine, people, okay? And then, not maybe the next day, but the day after, she came back upstairs, was complaining about, you know, this pain in her stomach. And I'm like, well, you're probably going into labor. You need to go back to the hospital. And keep in mind, I can't go with her because of Julian. Just can't, right? She knew where I was if she really needed me. So she went back to the hospital. I don't know if it was, when I do, at some point, even with Uncle John, I'm going to have to write things on a chart, because, you know, I got so much on my mind. Sometimes I get days off, 1 or 2 days, or I forget something. Like, you know, with Uncle John, I said it was the 21st when really it was the 23rd. Or, you know, I said that, you know, they said I was in dispute with Eleanor, but in fact, I didn't know who I was in dispute with for a long period of time, because they kept it hidden from me, just like they kept it hidden from me of my enduring power of attorney that was signed on with the bank in 1990 at the request of the bank. You know, they wouldn't give me that photocopy of that enduring power of attorney, as they're accusing me of being in dispute. No, as they're accusing me of elderly abuse, but not being specific as to what type of elderly abuse, and that there was a dispute, and that I was in dispute with somebody. That's all they told me, and then they told me to go get a lawyer. So, you know, it's been, what, 7 years since Uncle John's been medically kidnapped. So, of course, I'm going to get little gaps in there, because I'm doing other things as well, right? So at some point, after I get all the paper organized, you know, I'm just going to write down that timeline and to fill in the blanks. So just bear with me, okay? Because now we're working on Shimei stuff with Amari. And so whether it was the next day, for 5 days she was in labor. This is what I'm trying to say. The first day she went to the hospital, they sent her home with morphine. Then I think she stayed home. Okay, then I think she stayed home, and then she went back because she came back to me the next day on the 3rd day and said, Mom, you know, it's not going away, it's getting worse, blah, blah, blah. And I'm like, well, go back to the hospital. So she went back to the hospital, and then I think they sent her home again. Okay, I used to remember, but now it's been a while, so I'm going to have to double check. They sent her home twice. So then she went home, and I think they gave her morphine again. So now this is 3 days of basically being in labor, right? And then by the 4th day, she went back. Okay? She went back. Because it was just getting worse, and I told her to go back. So, of course, Julian's running around doing whatever, you know, whatever, and I'm just, you know, monitoring, I guess you could say, right? You know? And they let her have labor. Tisha said for 12 hours or something like that. Okay? It was long, long time. And nothing was really progressing in terms of her cervix opening up, right? Dilating. She wasn't dilating as fast. Now, keep in mind, it's her first birth, but she had already had 2 abortions, quite possibly 3, because I was told that maybe she had a 3rd one that she just never told me about, to which would have affected her cervix, people. It just would have, because that's artificial dilation, right? And who knows if she had complications from those abortions. I don't know, okay? So either or, she wasn't dilating as fast. And then what happened, from my understanding, I'm not a doctor, I'm not a nurse, I never went to school for medical, none of this crap, right? So anything that I read, if I don't understand it, I have to either Google it to understand what they're writing down in terms of their codes or their abbreviations or whatever it is. I have nurses' books downstairs. I'm thinking to pull them up and bring them up. I really am. I don't know what's in them, but they're nurses' books. Like when you go to school to be a nurse, they're actual freaking, like, thick textbooks, okay? I'm going to find them. I have one here, but I don't know. I've got more downstairs. I'm going to find them, and I'm going to bring them up and cross-reference where I can, because it's really important to connect these dots, okay? So anyway, her labor pains went on in a hospital setting. Tisha said 12 hours. I can't be 100% sure on that, but it was a long, long, long time. And then it got to the point where Amari's heartbeat dropped and it wouldn't come back up. And that's why they cited the emergency C-section. Now, how long it took for them to prep for her to go into an emergency C-section with Amari's heartbeat dropped and not coming up, I don't know. How long does it take to book in an emergency C-section when the baby's heartbeat has dropped and is not going back up? Because that was the reason they did the C-section. Just because Amari's heartbeat dropped and didn't come back up after 5 days of being basically in labor, with Shimei barely dilating through the whole process. So they booked in their C-section. They made it a fun little event because Julian's there recording. Shimei's right behind the whatever, smiling, you know, because you got the epidural, so of course you don't feel nothing, right? Baby is born, and as they're cleaning him up after he's born, somebody, I guess it was Julian, I guess we can thank Julian for this one. I don't know if it was Shimei. I doubt it was Tamika, but I would assume it was Julian who took the picture of them cleaning up Amari after he was born from the C-section, and he came out that way. He came out that way, people. So now, the point of this video is you can see clearly that I'm angry because I know what happened. I gave birth to 5 kids, all right? With or without epidurals. And one of them, Marcane, at 9 pounds, took me an hour to push him out without an epidural, okay? With his heartbeat going up and down, up and down, up and down through the whole process. But he didn't come out brain damage because his heartbeat kept coming back up. Amari's didn't. And the minute he was born, he started showing signs. And they covered it up. Just like they sent her home 2 times with morphine, knowing it was her first pregnancy, knowing it was high-risk pregnancy with the fact that she had a previous abortions that could have very well affected her cervix to the point where it wouldn't or couldn't dilate. And they sent her home with morphine, of all things. But she didn't take it. You see, that's the thing. Anyway, let's keep this video short. Because I'm working in a freaking fog. And a magnifying glass. And I'm going through just that little part. It's not very much. At the time that he was born. And I just want to highlight on a couple of things here so that I can stay focused and get this done, which will probably take me a few days to go through the whole thing. Because I read every page. Okay? And not only do I read every page to the best of my ability, because some of this reading, you can't understand it because it looks like chicken scratch, right? So I read what I can read. And I take my little notes, okay? So that after it's all put together, hopefully I'll find the time, assuming, depending on what crisis is going on, to type it out for my evidence. Anyway, I got a little bit of stuff here, and I just want to highlight on a few things around this situation. Okay? Now this was this page right here. Okay? It's called Variant Record Progress Notes. Variant is the term that they use for signs that don't appear to be normal for a newborn. Okay? And they started this on September 17th at 0415 hours. And then at 08, it says, babe. So, went to mom. And they're trying to get him to feed. Anyway, by 1100 hours, which would be, I think, 11 a.m. in the morning. Okay, let me just read it from here, because I wrote it down already. This was on the day he was born. He was born at 1:47 a.m. in the morning on the 7th. So by 11 a.m. in the morning, okay? So he was born at 1:47 a.m. in the morning on the 7th. And by 11 a.m. through their documentation here, he was listed as jittery. And then at Dr. Singh, he checked the blood sugar. And of course I'm looking, what is BS 3.2 mmol? So I'm typing that in, Googling, and it turns out they're checking his blood sugar to find out why he's jittery. Don't forget, he came out like that, people. He came out like that, people. Have it on recording. He jumped. Babies don't jump. Like I said, Amari's a Houdini baby. And then at 11:45 a.m., he was really, really drowsy. Baby didn't respond to cold cloth. He was so drowsy that they put a cold cloth on him to wake him up so that he would latch on, because they want to release her now, right? Right? They want to make, this is their checks, right? And they're making plans to release her as soon as they can, right? But he was extremely drowsy, and he didn't even respond to the cold cloth. Okay? And then by 2:25, I'm sorry, then by 9:25, because I'm going on whatever, they're showing signs here, right? And then by 9:25 p.m., he was very jittery and fussy. Very jittery. That's what they wrote. And fussy. And then by 9:40, jittery and fussy. It didn't stop. And that's another thing. For the first month of Amari's life, you know, even Shimei noticed it, but nobody could really pinpoint, right? You know, he always looked mad. Right? And I said to her, like, why is he looking so angry? Like, so... Well, it's because he had brain damage, people. 9:40 p.m., jittery and fussy. Different doctor. Now there's a different doctor involved. Ordered another BS3. Makes reference to emergency C-section. Just from what I can read, they make a reference to the emergency C-section. That's all that's on this one page. Okay. So now that I've done that, I can put it in my folder. Well, my little plastic thing. And it's right there. Then, now bear in mind, I can't see, okay? But, I'm doing, then we've got this piece of paper. I put this sticky, you know, I covered up what needed to be covered up, if anything needed to be covered up. And that's just like healthcare numbers and that kind of stuff, right? And what this is this is a lab report. Okay, let's see if we can get you to see it. Okay, this is a lab report. Okay? And if you notice the results, where's the results? Right here. Okay, there's all the results. And this was done on the baby boy. Okay? This is a newborn screening. They screened for... What did they screen for? Amino acid disorders, negative screen. Fatty acid oxidation disorders, negative screen. Organic acid disorders, negative screen. Androgen disorders. Here they've got, note, hypothyroidism can develop at any time during infancy or childhood. So, of course, I look up that word, right? And it says that it has something to do with the thyroid not working correctly. Okay? Anyway, I guess it was a negative screen, but they're putting a note there that it could develop later on in life, right? Hemoglobin opathies, negative screen. Galactomia, negative screen. Cystic fibrosis. Here they say, note, a small number of cystic fibrosis patients will screen negative in the newborn period. If there is clinical suspicion of CF, poor growth, loose stools, persistent cough, or respiratory concerns, further testing is recommended. So he came out negative with that, but again, they're highlighting that it could develop later on, right? Summary, screen negative for all disorders, okay? Attention. This part I don't understand. The transfusion state. What does this mean? The transfusion state of this newborn was not indicated on the newborn card. The results for many of the disorders screened can be invalidated by transfusion, and the reported results assume that no transfusion took place to sample collections. Are they talking about a blood transfusion at the time of his birth? And if that's the case, why didn't they list it on the card that he didn't receive that? I'm just asking, people. I'm just asking because I don't know. And I already read to you what they were screening for. Newborn screening is not a diagnostic test, and all positive screens must be confirmed by follow-up testing. There is also a possibility of false positive and false negative results. Any infant with clinical features suggested of a disorder listed above should be investigated regardless of the screening results. And then I'm going to show you this one, and I'm probably going to end this video because I just want to focus on getting this done, unless of course I see something else and I just want to come back and highlight on it, because at the end of the day, after it's all said and done, and I get it organized in my head and get it figured out how I can present it to the court in combination with Shimei's medical records, right, in terms of that 5-day labor period, where 2 of those days out of the 5 days, she was literally sent home with an opiate, I might add, that she didn't take, I might add. But yet Amari came out, and then they proceeded to list it down. Accused her of doing drugs. Okay? Because this next piece of paper that I'm going to show you, okay, suggested that she had an opiate in her system. This is Amari's urine test. Okay, do you see? And this is discharge date. She gave birth to Amari at 1:47 a.m. on the 7th, and they discharged her on September 9th after a C-section. So 2 days later, they discharged her. And this test was done on the arterial cord blood gases, to which this is Amari's, what was in his system, and they do their toxicology and drug screening. Okay? We've got urine ampet, not detected. Urine benzo, I guess that's amphetamine. Urine amphetamines, not detected. Urine benzo, not detected. Urine cannabis, not detected. Urine cocaine, not detected. Urine methadone, I would think, not detected. Urine oxycodone, not detected. But urine opiate comes out detected with an A and then an H. And with that said, that was their cue. That was their door in the foot to start accusing Shimei of doing drugs, because she had admitted to doing drugs prior to, like within the first 3 months of her pregnancy. And then once she decided to keep the baby, that was it. She just told everybody to fuck off, basically, and leave her alone because she wanted to have a healthy pregnancy. To which all her ultrasounds came out normal. The baby was growing. Everything was normal until he was born, people. And then, because they now had a reason to call in the social workers, call in the hounds, I guess you could say, what I get back is this. Because don't forget, just like they were doing that rumorville in the hall and getting all the workers to gangbang on me, accusing me of something that I never did, so that so-and-so could collect their bribes and the immigrant workers could stay working in this country, do as they're told, and don't rock no boats, and, let Uncle John get medically kidnapped, accuse that girl, she can't fight back, doesn't matter, run her out of town, right? Retaliate against her, threaten her. Well, they started doing the same kind of fucking antics with Shimei. Whispering around, coming up to her saying you were doing drugs. When they knew that she had a C-section, people. That opiate was fentanyl. They got her listed with fentanyl in her files from that C-section. Okay, it's either morphine or fentanyl. I remember reading fentanyl in Shimei's files. They were giving her fentanyl. It comes in with the anesthesia as they do their C-sections. So if they know that, why are they calling in the hounds? And then removing that information when the files are requested. Okay? Severed pursuit to section 22.1 and 22.3 under the Freedom of Information Act. 1 page. This is all directly related to this falsely accusing Shimei of doing drugs. Why do you think they were released? She was released on the 9th because she wasn't, people. So whenever Julian's sister gets up in there with her freaking yakety yak bullshit crap, here's the documentation. I'm showing it to you. Okay? They hid it from me. They hid it from me. Okay? 1. Where am I? 1. 2. Hold on. 3. 3 pages. All related to this one issue. And they were still doing that shit when anywhere I go with Amari, even till this day, I have to remind them. When our Amari went for the MRI, they were whispering around how Shimei was doing fucking drugs. And that's why Amari was there getting for the MRI, which is a bunch of crock people. Okay? Because they're trying to cover up what they did to my grandson. Whether it was done with intent, to which I do think it was done with intent, because they immediately hooked him up into that program at the Children's Hospital under that research study. Okay? And they invested $1 million into an operating team that is designed just to take out organs from children like Amari to put them into other people's children. And if they can get away with it, they will launder those freaking organs through the black market and get paid for them. Okay? As they do this shit. As they do this shit. So they took away all this information based on one thing. How do I explain that to a judge when the judge is not going to want to hear it? Tell me. Tell me. Tell me. But it's clear to see. If they're hiding the information, they're stalking her at the fucking bedside after he's born, saying, well, you tested positive for opiates. It says right here, come on, spill the beans. We know you've been doing drugs. And she's saying, no, I didn't. And then they had to back off and say, oh, yeah, right, sorry, it was our mistake. It had to do with the C-section, with the anesthesia and whatever else they gave her for pain medication. And then they released her 2 days later. Whatever the freak hell that they did, whatever the boo-boo heck that they did, it followed her. And it still follows me, people. It still follows me. Because all they have to do is suggest it to spread the rumor far and wide, to distract away from what they did. Period. So am I clear? She was in labor for 5 days. They left to the very bitter end. They created themselves in an emergency C-section with Amari's heartbeat down, not coming up. And then when he was born, he was already showing signs, but they ignored it. He was showing signs through their assessment, and they just did a blood sugar glucose test or whatever the heck that thing was, right? And then they tried to blame the mother for it based on a test that clearly they're looking for dirt on mothers. And if they can find it, that's when they call in the social workers to cover their asses. To cover their asses. Right? This is your healthcare system. And because Sierra, like I said, they infect one with the drugs in the house so that they broad sweep the whole family. And through Sierra, with her drug addiction and everything, and her pregnancy and everything, it was just a given that they were going to cast stones in judgment and prosecute Shimei. Period. And they did it. They did it. They did it, people. They did it so much they don't even want me to see it. But, like I said, maybe I wasn't at the hospital 24/7. But they were accusing Shimei of doing drugs, but it held no weight. So they released her on the 9th because they knew that if we challenged it, it was their drugs that came up in Amari's cord. They're opiates. But they already damaged the reputation of Shimei and the rest of her family. And to this day, if I go to a doctor's appointment, I don't know when they're going to throw it at me, because it's listed still in Shimei's files through just their passing of files that the mother was a drug addict and that somehow Amari is the way he is because she was the one who came out testing positive for this crap at the time of Amari's birth, which is just a bunch of fucking crap. And then I'm standing there having to defend my daughter and her integrity and let these people know that those files have been falsified. And then they just, oh, okay. But you know, there's going to be a day in 5 years from now when I go to another doctor's appointment and they're going to come back and say, oh, well, the mother was doing drugs. I'll be like, no. Just to keep you angry, just to keep you self-doubting yourself, just to keep you derailed and frustrated and angry and annoyed and just everything negative. Always having to defend your family's rights to life when they're the ones tweaking the files, when they're the ones who actually cause the physical injury against innocent human beings, and in this case, at the time of Amari's birth. You're not in labor for 5 freaking days, man. So I'm thinking there was something wrong with her cervix because of probably botched abortions. And that's why it didn't dilate. Why don't they follow up on that crap? But you see, they make money off of C-sections. And here's another little story. I'll end it on this one real quick. You know what they did to Tisha? Tisha's almost ready to give birth, right? They wanted her to go for an ultrasound. Because they're going to get ready to, you know, right? Make plans or whatever. They wanted her to go for an ultrasound for whatever reason. They gave her the ultrasound. And through that ultrasound, Alea May pooped in her stomach. So then all of a sudden, that ultrasound turned into an emergency C-section. Now, isn't that convenient? Isn't that convenient? What did they do with that ultrasound to make Alea May poop to the point where they had to call an ambulance and have Tisha picked up from wherever they were giving her that ultrasound and then take her to the Surrey Memorial Hospital for an emergency C-section? Doesn't that sound too convenient? It does to me, especially when I birthed 5 kids. It's not that hard, people. Well, it can be, but you get through it, okay? So I'm suspicious about that. I figured they zapped Alea May. So much so with their ultrasound that she pooped. Because they wanted that extra money from the government to support their freaking hospital through emergency C-sections. Because you know it got billed, right? Anyway. I don't know. This here, this stuff frustrates me so bad, I can smell my own BO right now. I'm breaking out in a sweat. And I don't sweat. I can work in the yard all day and not smell like BO. Only certain times when stuff like this just, ooh, right? It, ooh, like, because I know people, right? You know, like, and I'm so helpless to do anything about it other than what I'm doing. But all this right here, do you see how much that is? That's all pretty much to do with their botched MRI. Now, I haven't gone through it all, but yeah, it's all to do with their botched MRI. Yeah, MRI. So not only are they making money on emergency C-sections, but they're making money on emergency C-sections that literally injure children at birth. As the workers come in and use a standard test to pinpoint somebody doing drugs so that if something goes wrong, they can blame the mother before themselves for their nefarious activities, right? All it took was their anesthesia to call in the hounds and then remove that paperwork where I can't see it. But yet, like I say, if I go to a doctor at some point in the future with Amari, they're going to come up with, oh, the mother was an addict. I'll be like, no. Where are you getting that information from? Because the damage is already done, right? They already created that rumorville. And because they operate under a mob mentality, it goes through the whole freaking workforce because it goes through the files. And because the files are incomplete or they're altered, you know, people go for that gossip. They go for that gossip. And if they're inadvertently or directly involved with illegal organ harvesting or whatever else, trafficking of children or human beings, then of course they're going to feed into that rumorville. right? Because, you know, the more they can cut open and take out and put somewhere else, the more money they make. And whether it's the hospital getting paid for that through pharmacare, or whether it's through backroom deals with suitcases full of money going under the gurney between doctors and the people who deliver the body parts. So all this right here basically has to do with the MRI. So they're making mad money, people. And this was the botched one. Okay? This isn't the one that's at the children's hospital. They made all that money, and then they wanted me to book Amari in for another MRI after those workers had a badass attitude and went out of their way to wake Amari up in that machine. And that's why it got botched. But they don't care, because they're making money for the hospital. And if there's in there one, some, or two, 3, or 4 taking bribes, they're still making money. Okay? So after it's all said and done, I don't know, I have to, you know, I don't know if I'm going to make my deadline. There's too much. And that's why they attack in multiples over a period of years. Because they tried to overwhelm you with the grief. They tried to overwhelm you with the grief.